for me, what integrative psychiatry is I think that psychiatry nowadays ends up being sort of focused in on the neurochemistry of just the brain and how that is sort of separated from the body. And what we try and do is kind of integrate the notion that the brain is actually part of the body. And part of our approach is how the gut is sort of a first step in modulating all things downstream, including the nervous system. So whether you're going to be giving nutrients or address what's happening in the gut, and you're going to be giving medications, it all has to be absorbed first. And from downstream from there, we try and look at different sort of metabolic or physiologic aspects that can influence how the nervous system functions.
And just to add to that, I like to always use the analogy of what we do is we try to divide what is physiological causes of disease versus behavioral. And so oftentimes we'll walk that line of an individual that has multiple symptoms, and we'll do an entire physiological or metabolic workup on them, look for nutritional deficiencies, food sensitivities, anything that we kind of quote as like a nervous system irritant, and then work on those, and then there'll be a division between then what is behavioral, and then we can pull in other behavioral services as well to complement those.
And just from a strict kind of medical school background, embryologically, the gut, the nervous system, skin, a lot of the immune cells are derived from the same cell line. And so what we're frequently seeing in the clients we're evaluating at the Wholeness Center is that they have problem areas and chronic issues that affect all of those areas. So it doesn't make too much sense just to focus in on one area and try and modulate just the neurochemistry when there's a lot of other areas that are contributing to that organ system not functioning optimally.
So oftentimes on an intake, what we'll do is actually spend a majority of the time talking about other symptoms in the body, in addition to the primary concern, whether it be anxiety or depression or other concerns that are, kind of quoted as mental health issues. But we spend a good amount of time talking about diet, what's happening in the digestive system, is there any other issues happening or chronic medical concerns happening in the body so that we can address those as well.
And quite often, we'll have families bringing their young adult child or late adolescent child for whom there is a difficulty in discerning whether it is a behavioral issue or whether there's some biochemical trigger. And oftentimes, it could be both. And so part of what our comprehensive workup includes is therapeutic approaches to sort of augment what we're doing from a biomedical role so that we can identify what are some of the physiologic triggers, and then have the therapeutic piece to kind of understand what are some of the secondary behavioral aspects that were the resultant of chronic mental health problems.
So we have a couple of cases that we're going to go into that kind of describe this process and exactly kind of how our treatment plans fold out.